Hello. I am doing my presentation on major depressive disorder. Major depressive disorder is a permeating disorder that's triggered by situational factors ranging in intensity from mild to severe and is often a comorbid disorder with substance use disorders, panic disorders, social anxiety disorder, or obsessive compulsive disorder. Symptoms that are commonly related to MDD include having a depressed mood for most of the day, having diminished interest in most or all activities, having significant increase or decrease in weight, lacking sleep or excessive sleeping, agitation or sluggishness, loss of energy, a feeling of guilt or worthlessness, having diminished cognitive abilities, or having reoccurring thoughts of death. All of these symptoms can be symptoms of MDD if one has many of them nearly every day. While the exact cause of MDD is unknown, causes may include a combination of genetics and heritability and factors such as biochemical, psychological, or environmental. Potential risk factors that might lead to MDD include having a lack of social supports like friends and family, major life changes like moving, graduating, or divorce, financial instability, drug or alcohol use, childhood trauma, or even just living in rural areas. While this list can go on and on, it's important to note that these situational factors do not cause but might contribute to MDD. Prognoses vary depending on availability to healthy social supports, severity of one's symptoms, and the response to treatments. Approximately 50% of those who receive antidepressants are able to recover they may experience full remission of symptoms, although overall prognoses might be complicated by suicidal thoughts and impulses. According to an article from the National Library of Medicine, untreated depressive episodes in major depressive disorder can last from 6 to 12 months, and about two-thirds of individuals with MDD contemplate suicide, and about 10 to 15% actually commit suicide. MDD is a chronic reoccurring illness, and the reoccurrence rate is about 50% after the first episode, 70% after the second episode, and about 90% after the first episode. About 5 to 10% of patients with MDD eventually develop bipolar disorder, and prognosis of MDD is good in patients with mild episodes. So now we're going to move on to demographics. So some demographic statistics are 6.7% of the U.S. population experience MDD each year. Additionally, those living in poverty are twice as likely to report depression than those above the poverty line. So we're going to look deeper into how age, gender, and ethnic background contribute to MDD. For age, MDD can occur at any age between childhood and late adulthood, but the average age of onset is around 20 to 40 years old. MDD is increasingly becoming more common within younger generations, with trends of increasing incidence in young populations due to the increased use of drugs and alcohol. Regarding gender, women are 70% more likely than men to report depression and are 50% more likely to experience MDD. The difference between the difference has been due to the hormonal differences between men and women, childbirth effects, and different psychosocial stressors that occur between men and women. For ethnic background, Caucasian Americans report MDD at a significantly higher rate than non-Caucasian Americans, partly due to cultural conceptions of depression combined with mental health care access to mental health care screenings. So, for treatment options, there's a lot of contributing factors for treatment options, which include treatment setting, developmental stage, culture, physical and psychiatric disorders, suicidal symptoms, and stabilization needs. Some more common treatment options include pharmaceutical interventions, psychotherapies, animal interventions, electroconvulsive therapy, and RAP. So I don't want to go too in depth on each of the medications, but antidepressant medications are frequently the primary therapeutic intervention. And all antidepressants are equally effective, but they differ in side effects. And I've listed some of the FDA approved medications. So, this first one listed is usually the first line of treatment. And then the second one listed is often used for patients with depression combined with comorbid pain disorders. And then some atypical antidepressants. They're normally used for patients who develop sexual side effects. And then some of the other medications include mood stabilizers and antipsychotics, which are normally added to antidepressants to enhance antidepressant effects. For intrapersonal therapy, this is a form of psychotherapy. It focuses on adaptive strategies and social context in order to regulate symptoms through positive activities. And then cognitive behavioral therapy is another psychotherapy that focuses on managing mental health conditions in goal-oriented manner. And this is a combination of cognitive therapy and behavioral therapy. It's the most common form of therapy for those who are experiencing mental illness. And now, for everyone's favorite, there's animal assisted interventions, which include activities with animals or animal assisted therapy. And these interventions are proven to decrease general depression scores and provide a moderate level of relief to depressive symptoms. And this may be a standalone form of therapy or in addition to other forms of therapy. And now electroconvulsive therapy, it's a form of therapy for those who have had acute suicidality, severe depression during pregnancy, refusal to eat or drink, or have had severe psychotics. And this form of therapy is not a first-line therapy. It's for people with MDD, who have had other forms of treatment that have not helped regulate their feelings and thoughts. And those who go through electroconvulsive therapy undergo electric shock to help regulate their suicidal thoughts. And now, for a recovery perspective, the Wellness Recovery Action Plan, which is also known as RAP, has values which include hope, personal responsibility, education, self advocacy, and support. This is a crisis plan that has 6 steps which help you through creating a crisis plan to help you in your recovery. And it just gives you a crisis plan to help with tools and strategies to navigate each part of an episode. So now we're going to move on to some activities. So overall quality of life is positively affected by the increasing number of activities that one is engaged in. By simply putting on makeup, doing regular self-care routines, and participating in daily activities outside of one's home can significantly affect their overall behavior. Some recreational implications or activities that can improve one's overall well-being and help positively support somebody's mood and mindset includes having social visits with friends and family, attending church or another spiritual service to be in an organized and calm but comforting environment, and engaging in activities that encourage laughter, like seeing a comedy movie in theaters. Some modifications that could be made to one's life to improve their mental health may include changing one's diet, regular exercise, meditation, regulating sleep, forming healthy relationships, reading a book, avoiding drugs and alcohol, and doing self-care, because these activities can help with stress management, which can be difficult in times of stress, and they may help regulate episodes. And now for resources, I have 4 resources that I want to talk about to conclude this presentation. The first one is the Suicide Prevention Hotline, which is 988. This is important not only for those who struggle with mental illness, but also for the loved ones who are struggling, because sometimes loved ones need to understand that they're not helping during an episode, and they may need to get immediate assistance from somebody who can help calm those who are struggling. The second resource is a local resource. It's the Sacramento National Alliance on Mental Illness. And its goal is to transform the understanding and treatment of mental illness through basic and clinical research, which paves the way for prevention, recovery, and cure for mental illness. The next one is Substance Abuse and Mental Health Services Administration. And this is an important service that's provided by the U.S. Department of Health and Human Services. And it's important because substance abuse is a common risk factor for those who are struggling with MDD. And this agency's goal is to reduce the impact of substance abuse and mental illness on America's communities. And the last resource I have has podcast videos, blogs, and songs by Jason Keel. And he discusses stigmas behind mental health and wants everyone to know that it's okay to not be okay, and that there are people who are experiencing the same symptoms. Thank you so much for listening to my presentation. I hope you have a great day. Bye-bye.